Okay, so this is the exam for lower extremity peripheral vasculature. So you're gonna have your patient supine with their socks off, preferably in shorts or a gown to the patient's comfort level so you can visualize the skin. We're gonna start with just an inspection, looking from the inguinal ligament all the way down to the toes, looking for any obvious changes, any hair patterns, color changes, signs of infection such as a rash, bruising, scarring. Then we're just going to do the skin temperature. So I'm going to take the backs of my hands. I'm going to just palpate down the length of your legs. You just let me know if there's any pain with any of it. Feeling for any obvious temperature changes between the two sides. Especially heat, could indicate inflammation or an infection. We're going to observe for any signs of trophic changes, such as any scaly, shiny looking skin or any edema. Looking for any pigmentation in the ankle that could indicate like venous problems or bleeding. We're going to look at the skin and nail color, doing the compression test again of pressing down on the nail and releasing. The color should come back within 2 seconds. Then we're just going to move on to palpation. So we are going to palpate for any skin thickening, so feeling around the ankles for any changes between the two sides in skin thickness. And then we're going to palpate all of the pulses. We're making sure to use 2 to 3 fingers and not the thumb. So first, dorsalis pedis, palpating on the top of the foot. Doing them at the same time to compare side to side rate and rhythm, amplitude. Then we're going to do tib posterior. And then we're going to do popliteal, which is difficult to do bilaterally, so I'll just do one at a time. So I'll have your knee up. And this one. Okay. And then femoral. So I'm just going to have you make a barrier. You're going to find their ASIS. And then you're going to just palpate down the inguinal ligament. It's about like midway down. Both sides. Same thing, feeling for any changes in rate, rhythm, amplitude between the two sides. Then we're going to palpate across the inguinal ligament and the lymph nodes around there. So you can just have the patient keep the barrier up and do this all in a swift motion for the patient's comfort. So you're going to palpate down the inguinal, then up the inguinal. You're going from the ASIS down to the pubic symphysis. Then we'll do femoral auscultation. It's using the bell. Once again, you can have your patients make a barrier just to be safe. Find the femoral. And you would want to be skin on skin if possible, but it's up to the patient's comfort level, so I'm just going to do it through the shorts. Listening for any bruits. So any whooshing sounds. Then we're going to test for pitting edema. So I'm going to check the medial malleolus, the dorsum of the foot, and over the shins, pushing on it for 5 seconds, looking for a pit, and then if there isn't one, that would be normal. So pushing behind the medial, and then over the shin. Sorry, there. Okay. Then hernia check. So I guess I could have done that with the other ones up there. But so I'm just going to have my first finger on the artery, so the lowest finger, the middle finger will be over the vein, and then the last finger will be over the canal, feeling for any hernias protruding there, and you can feel both sides. So I'll have you make a barrier again. Going to palpate down and find the femoral, and then put first finger on that, second finger on the vein, third vein on the canal. And you can ask your patient if they feel any tenderness in that area, have any pain. And if you really wanted to be sure if they were having complaints, you could have them cough while you're doing that. Then for some more special tests, we have Holman sign. So I'm just going to elevate one leg and dorsiflex the foot. Ask the patient if they have any pain in the back of their calf. That would indicate thrombophlebitis. Phlebitis? I don't know how you say it. Thrombophlebitis. You could do that bilaterally. Then leg elevation test. I'm going to lift both the patient's legs up, hold it for 60 seconds. I'll have you pedal your feet, and then once I'm done, I'll have you sit up as fast as possible. And you're looking for all the color to come back to the feet in a relatively quick manner. So we'll just say it's been 60 seconds. So I'll have you sit up. And just observing to watch all the color come back to the feet. And that is it.